When you lose a tooth, what would happen is that the neighboring teeth, most of the time, they move a little bit, and that might affect your biting ability, and you'll probably favor one side than the others. And then problem starts by cracking some teeth or having some gum problems or difficulties in speech. And so when you replace your missing teeth, what you're doing is that you're putting back what you've lost, and that will keep the whole teeth in the right position, and it will give you a better speech, better ability to eat, and also give you back your self-esteem and everything as well. So it's very important to keep what you have, because eventually you will have a lot of bone loss as well, and it will affect the whole bite in general. It will be preferable to replace that tooth soon after we lose a tooth. And the way we do it those days, we do something called a socket preservation. What it is basically is that we remove the tooth, and at the same time we try to remove it atraumatically, meaning that without really damaging the bone around it, and put some bone back, artificial one, and then suture it back and wait for about maybe 3 to 6 months to have enough amount of bone. And then we come back and we take another x-rays, which is called a cone beam, and basically with that x-rays we see how much width and height of the bone we have available, and then we can decide on the size of the length and the width of that implant that can be suitable put in there. If we leave it, on the other hand, without doing any of that socket preservation, then the bone in there is going to be lost, and it will be probably difficult eventually to do an implant in there. And then if we want to do bone grafting afterwards, it's going to be a more aggressive type of surgery and more difficult. So it's preferable we do that technique, and it is actually a very easy technique to do, following any tooth extraction. And with any extraction, we try to provide the patients with enough information of that, because it's a procedure that it's going to prevent the bone from going down, and also it helps to keep the bone on the adjacent teeth on the same level without causing more drifting or shifting, because they're going to stay at the way they were before.